वेलकम टू आवर चैनल ओरायन थेरेपी क्लिनिक। ਤੁਹਾਡਾ ਸਭ ਦਾ ਸਵਾਗਤ ਹੈ ਸਾਡੇ ਚੈਨਲ ਤੇ ओरायन थेरेपी क्लिनिक। आप सबका स्वागत है हमारे चैनल पे ओरायन थेरेपी क्लिनिक। Thank you everyone for tuning in. Thank you everyone for always liking and subscribing. And today we want to talk about something very different. A lot of people that are patients, a lot of you out there always wonder, why do you feel pain in your body when you feel stressed out, when you feel anxious, when you feel anxiety? ਸਾਡੀ body 'ਚ ਸਾਨੂੰ pain feel ਹੁੰਦੀ ਹੈ ਜਦੋਂ ਸਾਨੂੰ ਬਹੁਤ stress ਹੁੰਦੀ ਆ। Is that true? Can we possibly feel pain in our body from stress, from anxiety? What happens at times is our symptoms don't match with our pain. So is the pain actually there? That's what we want to talk about today. And the answer is yes. The pain from anxiety and stress exists. When you have anxiety and you do not deal with it, when you do not speak to someone and you have stress that you cannot bear, overwhelming stress, that causes you something called psychogenic pain. That psychogenic pain is a psychological pain that is started when you feel feelings of anxiety, when you are unable to express to anyone what you are feeling, when you feel overwhelmed and you feel stressed out and you're asking yourself answers to questions that you don't know exist, or there's questions that don't have answers. That causes you anxiety, and being over anxious can cause us pain. That pain no one else will understand, but it's called psychogenic pain. In fact, what a lot of you out there may not know, our central nervous system obviously exists of our brain, but another part that we don't realize is our spinal cord, which is directly linked to our central nervous system. In fact, our central nervous system, our CNS, is made up of our brain and our spinal cord, meaning when we feel extra stress, when we feel anxious, when we feel anxiety, when we feel overwhelmed, when we have overbearing thoughts, when we overthink, we don't have answers to questions, we can actually feel pain in our spinal cord, which is caused from anxiety. Not just our spinal cord. Once our brain feels overworked, we don't compartmentalize our thoughts properly, we don't speak to someone about it, we feel pain. And that pain is psychogenic pain. It is very real. How can we take care of that pain? How can we avoid that pain? How can we know when we have psychogenic pain? Well, when your symptoms don't match with the pain that you have, just sit down, take a minute to yourself and ask yourself, do you feel anxious? Do you feel stressed out about something? Are you asking for answers to questions that don't exist? That is what's causing you pain, because your symptoms will not match with your pain, because the pain is psychological, that has now transported its way into your body, becoming physical. But no one else will understand because they do not have the psychological effects on their body that you have. So it is very important for us to work through that pain, to realize that psychogenic pain is real. It is important for you to compartmentalize. Often what happens is we have a bookshelf. We read a book, we put it away on the shelf. We read another half of a book, we put it away on the shelf. We keep putting books back on the same shelf, not realizing that eventually that shelf will get heavy. It will break and it will fall down onto other books. The books will now get mixed up. You don't know which shelf each book belongs on. That is what causes you anxiety. Your thoughts are discombobulated. They're mixed together. They're jumbled up together. You don't know what you're thinking anymore. It is extremely important for us to read a book, put it on the right shelf, read another book, put it on a different shelf, and be able to tell the difference between the two so the shelves don't break onto each other. That is the power of compartmentalization. And that is what will help you avoid psychogenic pain. So if any of you out there feel this pain, it's real, it exists. Talk to someone, like, subscribe to our channel, and stay away from psychogenic pain by staying in tune with your thoughts.